The colored fluid in these containers represents the amount of blood the average human adult body holds, about 10 to 12 pints. Blood transports nutrients and oxygen around the body and is essential to life. But blood may also harbor bacteria and viruses that can cause illness and even death. These harmful microorganisms are known as blood-borne pathogens. If blood containing pathogens touches your hands, eyes, or other parts of your body, you too could become infected. You could become ill and you could die. Human tissue and body fluids, such as saliva and tears, may also harbor pathogens and likewise must be avoided.
You come in contact with someone else's blood or body fluid, and it enters into your system through one of those openings in your skin or through your mucous membranes, is the primary route of exposure.
There are many kinds of blood-borne pathogens, but the primary threats to employees are the hepatitis B virus, HBV, the hepatitis C virus, HCV, and the human immunodeficiency virus, HIV, which causes AIDS. A vaccine is available to prevent and treat hepatitis B. More about this in a few minutes. But no vaccine is available for hepatitis C or HIV. Take a moment now and think about your coworkers. A nice bunch, I know. And think about all the other people you come in contact with every day, whether service technicians, delivery personnel, or other vendor workers. The truth is, any of your coworkers and any visitor could be a carrier of a blood-borne pathogen, and the person might not even know it. This is why these diseases are sometimes called silent killers. If a carrier is cut and begins bleeding, and you are exposed to the blood, you could be infected too. In the U.S., there are an average of 35,000 new AIDS cases, 36,000 new HCV cases, and 300,000 new HBV cases every year. About 10,000 of these HBV infections occur on the job, making HBV the greatest single blood-borne pathogen risk to employees. Estimates are that hepatitis B alone kills 5,000 Americans every year, but any of these diseases may cause debilitating illness and ultimately death. Blood-borne pathogens, what every employee must know, is designed to make you aware of the hazards associated with microorganisms in the workplace and to provide information that will help you avoid infection. Content for the program is based on information provided by experts in the field and on various organizations' recommendations and requirements, especially the Occupational Safety and Health Administration Standards 1910.1030, Occupational Exposure to Blood-Borne Pathogens, and 1910.151, Medical and First Aid. The OSHA Occupational Exposure to Blood-Borne Pathogens Regulation requires employers to develop a written exposure control plan that identifies all jobs in which employees may come in contact with blood or infectious materials. Exposure control plans must be reviewed and updated annually or whenever workplace changes affect job duties. We can't cover everything you need to know to work safely, but we'll introduce and reinforce safety procedures that apply in most situations. Some occupations naturally involve blood and other body fluids. Medical workers, paramedics, police officers, and so on routinely deal with bleeding individuals.
Blood-borne pathogens can be spread not just through cuts or open areas on the skin, but when blood comes in contact with any mucous membranes, like the eyes, the mouth, the nasal passages, those blood-borne pathogens can be transmitted.
In non-medical settings, such as manufacturing plants and offices, facility nurses, housekeeping personnel, cafeteria workers, and other employees who perform human-related duties are most likely to be exposed to blood or other body fluids. But all employees are vulnerable. If a coworker, for example, is cut while opening a box with a razor knife and you go to her aid, you could be exposed to her blood if you don't take precautions. When accidents like this happen, the OSHA Medical and First Aid Standard makes employers responsible for providing prompt assistance, in fact, within 4 minutes of learning of the incident. Because most facilities are not within 4 minutes of a hospital or other emergency medical provider, OSHA requires that an employee with medical training be assigned first aid duties and provided adequate supplies. This person is sometimes referred to as the first aid responder.
A first responder or first aid attendant in a company is actually responsible for helping someone who's injured or ill in the first 15-20 minutes that it takes to get an ambulance there. They may be responsible for performing CPR, for doing bandaging, helping someone control bleeding or blood loss, as well as doing cleanup procedures.
OSHA requires that any employee who may come in contact with blood or body fluids as part of the person's job receive initial bloodborne pathogens training at the beginning of the assignment and annual refresher training thereafter. This training should focus on bloodborne diseases and how they are spread, required and recommended work practices, personal protective equipment, and the employer's exposure control plan and procedures for handling emergencies and exposure incidents. To verify compliance, employers are required to maintain complete training records, including a summary of the training information, the trainer's name, dates training took place, and the names and job titles of all participants.
OSHA requires that bloodborne pathogen training records be kept a minimum of 3 years, so most companies just make them part of their employees' permanent record.
As mentioned earlier, the greatest bloodborne pathogen threat to employees is the hepatitis B virus. Some estimate that 1 in every 240 individuals is a hepatitis B carrier. Fortunately, a vaccine that helps prevent and treat hepatitis B is available. Employers must offer this vaccine to employees such as facility nurses, housekeeping personnel, and first aid responders who might encounter blood or other potentially infectious materials as part of their normal duties. The vaccine must be made available to these individuals at a reasonable time and place within 10 days of such a job assignment. Employees who don't wish to be vaccinated must sign a declination form. If they later change their minds, employers must provide the vaccine. Employers are not required to offer the vaccine to employees who do not encounter blood or other potentially infectious materials as part of their normal job duties. However, if any employee is exposed, for example by going to the aid of a stricken coworker, OSHA strongly suggests offering the vaccine within 24 hours of the incident.
You don't know where people have bled, where that virus may be surviving on a surface and you may come in contact with it. I'm talking something as simple as a shopping cart. You have a cut on your hand, you go use a shopping cart that somebody else used and maybe had a little blood spill on, kind of wiped off but didn't disinfect. That virus is so hardy that it can survive on that surface. You actually could contract it from that surface. It's unlikely, but it's possible. Therefore, if everyone was vaccinated against hepatitis B, we'd go a real long ways in controlling, possibly even eradicating the disease.
Vaccines are not foolproof, however, and no vaccine is available for HCV, HIV, or a number of other bloodborne pathogens. This is why it is vital that you avoid contact with possibly contaminated materials in the first place. Whether you are a person whose job involves exposure to blood or body fluids, a first aid responder, or just an employee trying to help someone in need, your first line of defense against bloodborne pathogens is practicing what are called universal precautions. This means regarding all blood or body fluids as infectious, period. In other words, no matter whose blood or body fluids are involved, even your most trusted coworkers, assume that the material is infected and that you must avoid it. Your second line of defense is using the proper personal protective equipment if your job involves exposure to blood or if you go to the aid of a bleeding individual. Employers must make personal protective equipment available and readily accessible to you and other employees. This includes gloves, pocket masks, face shields, eye protection, and gowns or coveralls. Having enough sizes on hand to fit all employees is also required.
What you can do to help someone, and actually it's part of most first responder training programs, is you teach scene safety first. Stop, assess that scene. In the time that you're taking to assess that scene and making sure that you're safe, part of that is actually applying your personal protective equipment. Pull your hair back, grab your gloves, then go help your person.
Disposable gloves are the most commonly used personal protective item because they provide a barrier between your hands and contact with the potentially contaminated material. Some individuals are allergic to normal latex gloves, so employers are also required to offer hypoallergenic or powderless gloves.
Before an employee puts on gloves, they want to check the gloves and make sure that they're 100% intact, that they're good. You know, gloves do, especially if you're using latex, will break down with exposure to heat, exposure to cold temperature extremes. You want to check them, make sure that they're completely intact and usable. When you don your gloves, basically you just put them on. Where you have to be careful is when you're removing them.
Be sure to remove disposable gloves as soon as possible after they're contaminated or if they become torn or punctured. To remove gloves properly, peel off one and hold it in your gloved hand. Then with your uncovered fingers, peel off the remaining glove from the inside, being careful not to touch the glove's exterior. Discard gloves in a properly labeled container. Disposable gloves should never be reused. Always wash your hands immediately after removing gloves or other protective equipment. If a sink isn't available, your employer must provide antiseptic cleansers. But if you do use antiseptic cleansers, it's important to find a sink as soon as possible and wash again with soap and water. Gloves are recommended for housekeeping duties such as removing bathroom trash. Wearing eye protection and a mask may also be appropriate, depending on how much of this work you do. Defense against bloodborne pathogens is learning, heeding, and using special labels and signs that warn they might be present. Warning labels bearing the words biohazard wastes or another clear message, along with the International Biohazard symbol, must be placed on all packaging that contains blood or potentially infectious materials. Specially marked red bags or containers may also be used. Some facilities place all contaminated materials in a biohazard bag, while others, depending on state regulations, use regular plastic bags and label them properly.
The proper disposal of contaminated items includes bagging those items in appropriate infectious waste bags, either red bags that are marked with the biohazard label or clear bags that are clearly marked with the biohazard label.
If you happen to be in an area where biohazardous materials are stored, never eat, drink, apply cosmetics, handle contact lenses, or do other personal tasks. In addition, never store food or beverages in these areas. Bags containing biohazardous materials must be removed from the premises by a licensed hauler. Some facilities arrange for a local hospital to handle such waste. Your fourth line of defense is following protective work practices that are designed to eliminate the possibility of cuts in the first place. For example, never pick up broken glass, metal shavings, or other potentially sharp items with your fingers. Use a broom and dustpan instead. Never bend or break used blades or sharp items, and do not recap needles after use. Always dispose of used blades, sharp items, and needles in puncture-resistant containers with leak-proof sides and bottoms. Large items should be placed in barrels or other strong containers. If you need to handle sheets of cut steel, metal strapping, or other sharp-edged materials, always wear heavy-duty gloves to protect yourself. If someone is cut in the workplace and blood winds up on the floor, machinery, or on other items, your employer's exposure control plan must include a written cleaning schedule that outlines the method of decontamination to be used. Generally, the housekeeping department will be assigned the decontamination task, but the following cleanup methods should be used by any person who does the job. Prepare for the cleanup by putting on gloves and, as needed, a face mask, eye protection, and possibly a gown. If you wear a gown, make sure it is tied in the back. Before beginning the cleanup, place a tape barrier around the scene to keep others away. If blood is on the floor, never mop or wipe it up because this will tend to splash the blood around. Instead, scatter an absorbent on the material, collect it with a broom and dustpan, and deposit it in a designated biohazard bag or container. Once the bulk of the material has been removed, the next step is decontamination using a disinfectant capable of destroying bloodborne pathogens. Commercial products registered by the Environmental Protection Agency and approved as hospital disinfectants are often used. But a solution of 1 part household bleach and 10 parts water is also effective. Leave the tape in place until the disinfected area is completely dry. You may use a sink to disinfect items that have been exposed to blood or body fluids, but don't rinse such items under the faucet. This tends to splash the material around. Instead, fill the sink with the proper bleach water mix or a commercial disinfectant water mix according to the manufacturer's instructions and soak the items. Always clean and disinfect the sink after exposing it to contaminated items. When the cleanup is finished, gowns, gloves, and other items must be disposed of properly according to your facility's policy.
Machinery that's been contaminated must be disinfected or labeled. If you have an area of a machine that cannot be disinfected, you need to attach a biohazard label, date it, identify the contaminated area. And that sticker needs to go on that machine, and it stays there indefinitely unless at some point in time you're able to rip apart that machine and actually disinfect the area that's been contaminated.